With us now is Senator John Hoeven of North Dakota. Senator, that Friday promised to get a reworked version out there. I guess it would be a draft more than anything else. How doable is that?
I think we'll have some ideas by Friday that we can take and get scored, and hopefully that'll help keep moving the process along. But all along, I felt we would be into July, and that realistically, hopefully have something done before August. I think if you go back and look, our leadership wanted to have a vote, if possible, by the 4th, but myself and a lot of others felt it likely would take longer. And so I really don't think this is too big a surprise.
Senator, do you feel the pressure? You're not among, so far, the 9 who have serious reservations of outright opposed to the Senate measure as it stands right now, but are you worried that this is going to be tough sledding just to get it down to no more than 2?
Well, I do have reservations about the current plan. I believe it does need improvement. We're talking about some of those ideas, and there is division within our caucus, and we need to find ways to make changes and improvements to get to something that I can support and other members of our caucus can support. We need to get to 50, and then with the Vice President, 51.
Do you subscribe to the notion better this bill than Obamacare? It might not be perfect, but it's a heck of a lot better, this, quoting some of your members, than the law it replaces.
We need to do something. Obamacare is imploding. I don't think this plan is good enough to support yet, but we got to keep working to get to something that we can support. We can't just continue to let Obamacare implode.
All right. Now, is there a point at which, Senator, you or your colleagues say, all right, we're going nowhere fast. Let's shelve this for the time being, proceed to tax cuts, or now are you so knee-deep in this that you have to do this now to go on to tax cuts?
We'll see. I think we're going to get something done. I can't predict the timing, whether we get it done now or ultimately it is possible we'd go to tax reform first. Regardless, though, you have to remember, with health care reform, this is one step in what's going to be a process. And it's going to take more than just passing a bill. That's what gets it started. You need administrative action. And we're going to have to come back and get some bills that we can pass with 60 votes to truly get the kind of health care reform that we want and that will last long term.
You know, I'm just an outside observer, Senator, but I'm amazed in the 7, 8 years since we've had Obamacare, and you and other Republicans have been critical of it. There was plenty of time to put together rather detailed packages. Some of your colleagues, in fact, did so. But why are we in this scramble right now when, that's a long time to come up with something?
Because you got to get enough agreement to do it. And I understand people feel a sense of urgency, but it's still more important to get it done right than get it done quick.
All right. We'll see what happens. Senator, thank you very, very much.
You bet.